You.
Beautiful. Okay, so we're gonna start off by just getting in the zone, getting in the mood, getting in the flow. So I want you to just imagine that Andrea sent you a Slack and says, Rachel, I scheduled you a new person. You're gonna absolutely love them. And you're like, wow. And so then you pull up their intake paperwork and you're reading it and you're like, oh yeah, this is my type of person. So excited for the first session. I've got this. What are some of the things that they wrote on their intake paperwork?
Um, I hate this. I'm so sorry.
It's okay.
Okay, hate's a strong word. Yeah, okay. What do I see? What comes before me?
Like when they type in, what brings you to therapy?
Um, I think what gets me excited, when I read an intake form is someone who's like willing to acknowledge that I guess something's going on. They don't need to know what that is, but they're willing to say, hey, I'm struggling with something internally, and are willing to start opening up about that.
Mm-hmm.
What kind of problems that I see and I get excited about because I feel like I'm going to be able to potentially offer them something, are those who are particularly struggling with substance abuse and like internal difficulties. And those could be any kind of internal, emotional, anxiety, difficulties regulating themselves.
Okay. So what are the kind of words that someone who's struggling with substance use would use to say that to you?
No, it's always different. Um, I mean, words that people often use, I guess, or that they feel stuck, that they feel overwhelmed and experiencing a lot of tension, don't know what to do with it, have tried a lot of different things and are struggling to like bring it together, for themselves. Some folks often, we have like the knowledge. It's there in our intellect, it's there in our thoughts, but we're still working to like bring it down to the core and our inner self and our emotional self. And so oftentimes like that's the stage people are at when they come to see me. They're trying to do that work also alongside just managing their substance use or trying to reduce it completely.
Okay. Do you feel like you tend to work with a lot of intellectualizers?
No, not necessarily. No. I mean, it come every people are different. Some people internalize, some of us externalize. Um, it's our some, I don't know, I think of it as like an emotional knee-jerk reaction, actually an emotional reflex. And we all have kind of oriented those reflexes in different ways over time, and maybe with substances, in addition to like what's going on in the rest of our lives. Um, and I don't know, that's how people kind of come to find you or find me.
Okay. Do they tend to lead with the I'm having trouble with substances, or does that
No.
come out later?
Sometimes, sometimes, but no, often not. That's not the lead in, and it's often not why folks may be directly realizing why they're coming to care. It's often something we may like uncover further along the way, that's kind of on it's like happening in their lives, and it seems to be impacting their mood, their stability. And so we start like looking at that more deeply. Some folks do come with a clear understanding, like, hey, this is an issue that I've had for a while. And I think for most people with a substance use disorder, you're experiencing emotional difficulties along the way, right? Rather that's something we're going to give another diagnostic label or not. I don't even know that matters, but we're experiencing both problems. And so most folks come in and they have both issues to work on.
Okay, that makes sense. Yeah, I'm just trying to think of like the language for yours. Do we lead with the substance abuse piece, or we lead with more the emotional pain and like maybe you're using substances to deal with emotional pain kind of thing?
I guess start with emotions and then move into substances, just because that's like, I'm not just a pure like substance use counselor. And at some point, given level of severity, I won't even be appropriate for them, or depending what their needs are.
Okay.
So I don't know that you'd want to market it as a substance use specifically, like that most strongly, if that makes sense, right? We
Yeah,
don't,
yeah, no, I get it. It's like primary mood, secondary substances.
yeah.
Okay.
I definitely see people though that are struggling with alcoholism, and that is the prime issue, but we're always dealing with both. And I guess that's overwhelming to some folks, but I guess I find that I'm able to help them hold that space and hopefully make it less overwhelming and workable,
Well,
because
that's
it
fair.
is overwhelming, right? We have like all these difficulties and it's like, where do we start? And so we spin around on that like sort of top for a while. And so I don't know, in therapy, we kind of start to slow that top down and see where it may make sense to go first.
Okay. Okay.
I mean,
So
oh, sorry.
no, you go.
Some folks like they do come and they have a clear anxiety disorder or a mood disorder, and then the substance use has come second. And so it may be, oh gosh, this is really hard to discuss like this. Um, yeah, I don't know. I lost my train of thought.
Okay. Well, if it comes back. Okay. So a lot of this is so that I can like crawl into your mind to try to write like you. And this isn't my population, so I'm probably gonna ask a lot of questions just to make sure I kind of get it right.
Yeah.
So with your folks, what does their internal chatter look like? Like so their pathological stuff. So like I have an idea what anxious chatter looks like. I have an idea what depressed chatter, like, what are some of the thoughts that would go through your head?
Same things. Same things. I mean, that's often like we look at folks with substance use issues and start to like think of them as like sort of different in some way. And they themselves start to think of themselves that way. But the chatter's the same. Um, it's negative. It's a lot of self-loathing. It's concern for the future. It's concern for what's happening to them right now, right here. What's happening with their family, how it's going for them and how they're interacting with their family. They see most people see those struggles when they're in therapy. That's why they're coming. And so the chatter is nearly identical. What you may also have mixed in is the urges to use. Some beliefs that those may be helpful alongside some other beliefs that we're working to develop that's highlighting that, hey, I don't have to do it, and there's another way.
Mm-hmm. Okay. So when they come to your office for the very first time, and maybe they're brand new to therapy, so they do not know what to expect, how do you
Yeah.
explain to them what it is that you do?
When people, I just talk about what therapy is. I actually work to make it more open and accessible, less pathologizing. It's me supporting you, helping you to find your goals and where you're ready to begin at. Um, you know, it's different. I'm maybe going to be able to hold space in ways that your friends and maybe an AA counselor can't for you.
Mhm.
Um, and we're going to be able to address, different difficulties, also from that clinical perspective that you may need. And so it may include sort of all elements of that. I may be a person that helps you hold yourself accountable. I may be a person that is a space that you're willing to start being honest or open a bit more, express yourself a bit more, maybe find yourself. So it may be different for everybody, but those are some, like, I guess, a common way I would explain it.
Yeah. Do you tell people that like, I use this approach, I use that approach, or just keep it pretty flexible?
I would say I'm an integrationist, so I'm trained in cognitive behavioral therapies and the evidence-based treatments, and definitely utilize those in our approach. But we're not just focused on like what we're doing and what we're thinking. We're gonna dig into our feelings and our relationships. Um, and so we do that somewhat. Some of our sessions may be really direct. Maybe that's where we're at, and that's what we need in different moments. Maybe it's just a space to feel. And so really work to use that interchangeably to your success and what you need. Because it's not one size fits all. And that gets lost sometimes when we just like focus in on what, like just CBT, for example. Well, there's about 1,000 other spheres of life that we just can't ignore. So we're really wanting to make space for all of that.
Hmm. Would you use the word holistic?
Not often. I mean, that doesn't, I think that's a good word to describe it. It's not necessarily one that like always comes to my mind.
Okay. Do you have some favorite interventions that you like to use, you get lots of success with?
I don't know how to answer that.
Or like, are you a big fan of teaching relaxation techniques or using thought records or exposure therapy
Get
or
into mindfulness. Like I think mindfulness is just like at the core of everything,
Mhm.
foundationally. And so I'd say that's a go-to in working to apply how that may like make sense for someone or may like fit in their worldview or if it fits. Um, and like trying to maximize that ability to uh be able to be quiet with the self and tolerate it, right? Well, like we can we sit with ourselves, but are we willing to tolerate it? Are we actually willing to like maybe even like it? So trying to like still and quiet the mind enough to like tap into some of that.
Ooh, I feel like that was a little soundbite right there. Can you give me your spiel on mindfulness, like how you would explain it to a client?
I
You're doing great. We're almost done.
can. I know. I can. Um, I'm just not. So how would I explain it to someone? Oh, it's so different just based on how the person comes in. Is it accessible to them already? Sometimes we just may talk about it from trying to be more still, being willing to be more quiet. Sometimes it may move into like attentional control right away. Um, or actually for most people, the entry point probably is relaxation. So it's like some sort of meditative, hopefully also relaxing, but like that type of an experience. But for some folks, it may just be like, how could I give myself permission just to move more slowly? To think more slowly at times, to actually like not react. That's a big one. Is it
Mhm.
possible for me to make it okay that like I actually don't even have to respond? But like non-response is an option as a
Mm.
mindfulness technique, right? And so those things come up a lot.
Okay.
Non-judgmentally. So the idea
Okay.
of trying to step away from not to reject them, but just at least at first to acknowledge them. Like, let's just like, can we differentiate like what I'm telling myself versus what I know to be true, and trying to develop that like a little distance there.
Mm. Can definitely work with that. Okay, let's see. So if somebody comes into the very first session, they they are just feeling awful. They don't know how this is going to help. They don't know if anything's ever going to get better. What would be some words of reassurance you would give them that, we're going to figure this out. It's going to be okay.
Um, it doesn't always have to stay this, it doesn't always have to be this way. Like this will change. Like your mood will not last this way forever. It doesn't have to, it's not supposed to. Like this will shift. Like it sounds awful. Like
No,
right now,
no,
I'm just like cold.
no, I think this is really good.
But
Yeah, no, this is really good.
yeah, like like it's hard. I mean, I offer my hope. It pending where it is, you may not have that, and that's okay. But know that I do, and feel free to remember that, right? Like maybe even remind yourself that like I think it's hopeful. This doesn't have to be the end. It does not have to, it may not mean this isn't something you have to deal with ongoing. But it does not have to look exactly like this.
Mm, another beautiful soundbite. Okay, two more questions. So, when you work your magic with your folks and they're getting better, like what are some specific ways people get better with you? Like they're more in touch with their emotions, or they're more at ease with just, how life goes, or
I'd say folks are able to start tolerating uncertainty better. Um, see themselves as like escapable and as having um agency in their lives. I think we're always working to like people, yeah, often just like being able to be comfortable with their feelings, like know what their feelings are, actually just be able to identify them and then not feel so chaotic, just in that recognition and being able to wrap their mind around it a bit more. So sometimes that's the strongest like thing, right? Other folks, I think they would say that I challenge them. And that's why they're there. They want to be there. I'll ask difficult questions. Yeah, I think that's, what was your question again, Bailey? What would they
uh
say helps them get better?
yeah, like, yeah, what does better tend to look like?
What's better tend to look like? Having more skills to approach those life difficulties with, feeling like they're not alone anymore. Um, not alone in themselves, not alone with the other people in their lives. Um, yeah, being willing to be more vulnerable with themselves and even with other people in their lives, which, starts to make things a lot more manageable
Mhm.
often. Mhm.
Okay, so I feel so I'm trying to like, step into your shoes, write to your people. So it seems like your approach is, I'm trying to come up with a good metaphor. I probably won't actually use this, but like you are not trying to teach people how to avoid the waves of life. You're just trying to teach them how to surf.
Oh,
And
yeah, yeah, yeah.
yeah, they're
Maybe
gonna
even
suck at
sometimes
it at
like
first.
dive into it. It may not
Yeah.
even be surfing. It may be like, how do I dive through that wave
Mm-hmm.
um, safely and get through it?
Mm-hmm.
Mhm. How
Yeah.
do I
You're
roll with it?
um,
Is it possible to roll with a rip current? And the answer is yeah. It's often the rip tide or whatever it is, right?
yeah.
Yeah. Yeah. If I'm,
Yeah.
yeah. Yeah. We're not trying to avoid, we're not trying to dodge. We may like, we're dancing, we're like moving and shaking around stuff, but we're always approaching
Okay. I think I got it.
it.
Yeah, so I feel like the tone is you're not trying to tell people it's all rainbows and butterflies. Like no, sometimes it's a storm and sometimes you can't do anything about the storm, you just got to weather the storm, but we're going to learn how to weather the storm. I'm going to be in
Mhm.
the storm with you. I'll throw you a life raft if you need one. Eventually you won't.
Yeah. Yep. Mhm.
Okay. Okay, is there anything I'm missing as far as like your vibe or phrases that you use a bunch, or like
Ah,
anything else that would capture you.
uh, not that I can spontaneously recreate right now, but I don't like even I know we talked about substance use a little bit or a lot, like depending how you look at it, but I don't want to lose sight of like, do you think like whatever we discussed, like what you got from me, is it still open to, or did we talk enough about like treating like anxiety specifically? Do you know what I mean?
Yeah. I can add that and make that like a heavier focus. So like depression and anxiety are big, substance abuse is second. Um yeah, I can make sure to add that in.
Yeah, I don't even, yeah, that's the struggle in trying to like, well, I mean, it doesn't really have to be, it can be like, yeah, with or without, it's all good. Um, but yeah, I guess I don't wanna, yeah, I don't know what I'm saying. I'm not just a substance use counselor.
Yeah. I think I get that like, yeah, primary is emotional pain, whether your emotional pain shows up as anxiety, as depression, as something else. And maybe you tend to lean on substances really heavy or kind of heavy, or maybe that's not your thing. And your approach is, you know, you can integrate the EBTs, but you're not beholden to them. But it's a lot of acceptance, it's a lot of mindfulness. If you need skills, you'll give them to them. If they need accountability, you'll give it to them. If they need challenging, you'll give it to them, but you're going to meet them where they're at.
Yeah, no, yeah, spot on, spot on. Yeah, that's me. That's what I hope to be, Ellie.
We did it.
Yay!
Okay, Andrew, you can stop recording if you'd